as David said, is a small non-profit research and public engagement organisation. We are based in Wynberg in Cape Town, and we opened our doors in 2010, and we work in the areas of the informal economy, health and community safety. So we're going to be talking to you today about a project called Bucketloads of Health. And Bucketloads of Health is not, strictly speaking, a research project. It's a public engagement project which is funded through the Public Engagement Fund of the Wellcome Trust. And these funds are aimed at making science more accessible to the public. But we wanted to take the opportunity about making public knowledgeable more accessible to science through this project. And essentially what it's looking at is some of the health risks of saving and reusing water. It's a 12-month project, it's currently ongoing. We started in February this year, so we're 7 months in. And of course this is all happening in the context of the Western Cape drought, which is we're still currently under level 6B water restrictions. And so what we were interested in looking at with the Bucketloads of Health project was people's experiences of water restrictions and water shortage living in different areas of the Western Cape of South Africa. So when I talk about making science more accessible to the public, we had scientific partners. And they were Professor Khan, Professor Wessal Khan, who's a microbiologist in the science faculty at Stellenbosch University, and her team, who you can see here. So they were the scientists that we were working with in this project. And what they are doing is they have put big water tanks, so like big Jojo tanks, into an informal settlement called Enkanini, which is very close to Stellenbosch, and they are they're harvesting rainwater into these Jojo tanks. So they're taking water off the roofs of some of the shacks. They've got 3 of these water tanks in the community. Enkanini is fairly small, it has a population of about 5,000 people. They have put these water tanks in and they are testing the water for microbiological contamination, and they are also looking at ways of treating that water to try and make it safer for domestic and household purposes. Okay, so what they're finding, and they've published widely, this is only 3 examples of their research, but they've published very widely on what they're finding in the water that's coming off these roofs, and it includes all kinds of bacteria, viruses and parasites. There's lots of Legionella, there's lots of E. coli in that water. So in terms of the communities that we worked with, or the public that we worked with, we worked in 2 different areas of the Western Cape. We worked firstly in Enkanini, so itself, which as I said is just outside Stellenbosch, and then we also worked in Delft, which is a township in the city of Cape Town, and these 2 locations are about 25 kilometres drive away from each other. The reason why we chose to work in Delft is because Sustainable Livelihoods Foundation has been working in the Delft community for 8 years. We have established a strong community network, and we felt it was important that we looked at the experiences of water shortage in more than one community, to bring the opportunity to engage with science to more than one community, and also to give the scientists an opportunity to hear about how people were experiencing water shortage in a community other than Enkanini, which is where they're working. Okay, so this is Enkanini, as I said, fairly small informal settlement by Stellenbosch, and this is just an aerial view of Delft, which is much bigger, very different context. There's a population of about 100,000 people in Delft, and we were working with people from 5 different areas. I don't know if any of you are familiar with Delft, but we were working with people from Roosendaal, N2 Gateway, Blikkiesdorp, Suburban and Leiden. Okay, so this is just a photograph, sorry for the shadow. We were working with 12 participants only from Enkanini, and I'll explain to you why we could only work with such a small group just now. So that's our Enkanini friends, and this is the 15 participants who were taking part from Delft. Okay, so what we were essentially doing was an engagement process between science and community. So the scientists were engaging with community of Enkanini, and the community were engaging with the scientists and on the other side the circle goes for Delft. But unfortunately, within the framework of this project, we haven't been able to bring the two communities together. Okay, so at this point I'm going to hand over to Jess.
Hi. So, throughout this project, we've held 2 creative workshops with each of the participant groups, and this enabled the participants to create materials that they could convey their experiences, their perspectives and their opinions around the topic of water. Each creative workshop was a duration of 5 days, and participants worked individually as well as collectively, as you can see here. For example, producing community maps as well as body maps. Music making and storytelling were also core elements of the creative processes. So in terms of the creative processes, it was a very sort of layered process, and we started off with talking about water as a whole group, and we looked at different types of water that are found in their communities, and we created a water identification chart, and so each water type has a different color linked to it. And this was very useful in terms of community mapping, and also led into body mapping. So from working in the big group, we then asked participants to work in smaller groups and to draw maps of their local area where they live and indicate where they find these different types of water. And then the community maps sort of acted as a springboard that we moved into body mapping, which is it's a personal process. And these are 2 body maps. They're life size. They're 2 meters tall and over 1 meter wide. And we asked individuals to sort of to reflect more personally on water and links to water that they have, and illustrate these on their body maps. And also think about recent or past experiences related to water, and related to a water type that was very prominent on their body map. From this, we went into a storytelling process where individuals shared their experiences and stories linked to water. And as a part of the stories, once participants were happy with what they wanted to say and wanted to share with the group, as well as at a later stage with the scientists, we went through filming the story narration, so that we could also create films with them, which can also enable a wider audience. So the story, the body mapping and the personal storytelling process surfaced main themes, and the Enkanini group, the main theme that they discussed was the prevalence of black water in their within Enkanini, and their concerns around health and the presence of black water in their communities, as well as the frustration of how wastewater and waste food is disposed of within their communities. With the Delft group, there was a lot of discussions around their confusion and their anger around the restrictive water meters that have been put in place. Some residents have a 350 litre restriction, some have free flow, and it's in different areas and different people, so there was a constant discussion throughout the 5 days. There were 4 main themes that surfaced from the body maps and personal stories of the Delft group. For example, the loss of community activities such as soccer tournaments and flower shows, around health and stress and sanitation, water and death, as well as in terms of children recreation, the loss of recreational activities that are very important for children in areas in Delft. So after the storytelling process was complete, I'm going to focus on Enkanini now. We went into Enkanini with the group to capture video and photographic footage for the film that we'll be showing you. The participants decided themselves where we would film, what we would film. They took the majority of the photos that you'll be seeing throughout the film. And we worked with Kayla Peterson, a video editor back at SLF, to create the film. So now I'll be showing you our water challenges, which is a film that was created with the Community Inspires, the Enkanini group.
The reason why in this project we were not able to work with larger groups of people was because in order to do a very deep participatory process, which includes things like making full-size body maps, you need big spaces and you need lots of time. And so it's quite clear, I think, that to do that with hundreds or thousands of people, it's just impossible. And so we were restricted with the number of people that we could work with, and we recognise that that is a restriction of the work. But as I said, this is not actually, strictly speaking, a research project. So we took the body maps and the community maps and the films into a knowledge exchange process with the scientists, both with the Enkanini group and with the Delft group separately. And as well as the Enkanini participants and Delft participants having the opportunity to talk about their experiences around water and their priorities for water provision, the scientists also, we tried to make it balanced so that the scientists also gave presentations about their work, and we did a tour of the laboratory, and we did hand mapping with the scientists, which I can't go into now, but it was a really remarkably opening up process to do hand mapping with the scientists. So we've taken the process into a film, which we're not going to show today. It's called Doing It Differently, and it shows what a knowledge exchange process can look like in terms of public engagement in science. It shows how the different participant groups responded to being in that public engagement process, and it showed why it's important and valuable to have knowledge exchange and co-learning between community members and people who are doing research in communities. And I should also say that part of the knowledge exchange opened up an opportunity for the community participants to speak out very strongly about how they felt about research being done in their communities, and it wasn't particularly positive. It was quite uncomfortable in many cases. Okay, so just to say very quickly what we're coming up to. Next week, the Enkanini participants want to run a community mobilisation event, so they're now taking their film, and the original version of that film is actually 13 minutes long. That's a 5-minute short version made especially for this meeting. So the original version of that film is 13 minutes long. They're going to take it next week into their community, and they're going to try and do some mobilisation around the ways that people are dumping their wastewater, their waste food and their litter in the community on each other's doorsteps, etc. We are going to be holding exhibitions in Stellenbosch and Delft, showcasing the work, showcasing the beautiful body maps and the community maps and the films and everything. We're inviting lots and lots of people, and if any of you can come, we would love to see you there. The Stellenbosch exhibition's on the 3rd of October. And we're taking the Delft participants into a policy engagement process with the City of Cape Town. There's also, just within the past couple of days, we've opened up a conversation with a research team in the Department of Environmental Ethics at Stellenbosch University, who have come to hear about this work and who are very keen to perhaps show the film as part of a trust building process that they are doing between the Enkanini participants and the Stellenbosch municipality, because over the years there has been a tremendous breakdown of trust between the Enkanini residents and their local municipality, because nothing has been happening in terms of water infrastructure. It looks like it's finally going to happen, but there's a lot of work that needs to be done to build a relationship between the community and the municipality, and they're hoping that the film can be used as part of that trust building process. And so, yeah, just quickly to go over our key findings. Working with participatory visual methods in the Bucketloads of Health project has enabled participants from both the Delft community and the Enkanini community to interact confidently with the scientists. They owned their body maps, they owned their community maps, and although they have never had to present in front of experts before, they stood up and they did it like a bomb. And by engaging with these innovative visual materials, the water microbiologists were able to see the topic of their research in a very different light and from a much more grounded community perspective. And in fact have said to us, many of the scientific team have said to us, I had no idea. I go in and out of Enkanini, we do our rainwater research. Now we see what the problem in the Enkanini is. It's the black water, it's the grey water, it's the drainage. What can we do? What can we do? So there was this kind of shift in seeing and this shift in thinking about the priorities for research. And also, you know, the project's taken on a life of its own with this community mobilisation event, which was never kind of foreseen as an activity of the project. And so, yeah, also want to say that the water-related priorities of individuals who are living in specific settings can therefore be misconceived and misunderstood by people who don't live in those settings but have decision-making power around water research and water infrastructure. And that the example that's given by Bucketloads of Health, these participatory visual processes can help to surface what people consider to be the most important uses of water in the places where they live and what they really need in relation to water provision. Just like to thank Pam Sykes, Victoria Hume for the beautiful music in the film, Kayla Peterson, who was the video editor, and Justin Patrick, who took the photographs of the body maps, and of course our partners and funders, the Wellcome Trust. Thank you very much.
Thanks for the presentation, quite informative. I just wanted to ask about the body maps. It's a very new idea to me, but I just wanted to understand the rationale behind using them and the sort of meaning and yeah.
Body maps is because they enable somebody to start thinking at a personal level. And we've worked with storytelling for a long time, and we know the power of storytelling, the power of the individual story, but to get people to think about themselves can sometimes be quite difficult. So the body mapping was a way of getting people to kind of like become introspective and start thinking about themselves and especially their bodies in relation to water. So that was the rationale. We went from this whole group approach of thinking about water generally, different types of water in the community, and then into the kind of community mapping, which was a small group process where people worked at tables of maybe 3 or 4 people, and then we went into the individual body mapping, where then people started to think for themselves about water in their lives, and to tell a story, particularly amongst the Delft group. And we have the films with us, and they're wonderful, important films, and anybody who would like to have copies of them from us today is welcome to take, because we have consent from participants to share them, but to talk about experiences that they had, which are very deep, and you wouldn't normally necessarily think of water shortage and water restrictions in the context of some of those stories. So for example, there was one extremely vulnerable young man from Delft who talked about last year his family burned in a fire in Guguletu. Many members of his family, including unborn children, because petrol bombs were thrown in the windows of the house in the wee small hours of the morning by a jealous boyfriend. And so the whole house burned down, everybody was killed. He was called to the scene and had to watch this, hear the screaming, horrible, horrible, horrible. Nobody would give him water, you know. So it's kind of those stories that show the more kind of nuanced details of what it means to live without water and what water restrictions do in people's lives. So that's why the body mapping was a way of kind of getting people to think at a very personal level, basically.
The rationale for choosing a smaller subset of participants. But I was wondering if you could speak a little bit further about how those participants came to the project in the first place. Because it seems like in so-called community engagement projects, there's often a temptation to kind of presume a homogeneous kind of constitution of the community. Like, oh, I can pull out a community member here and there. So could you tell us a little bit more about who these people are specifically and how they came to the project? Were they particularly interested in water issues? It was more or less a random encounter? And how are they connecting to other people who may differ from them demographically?
Because our aim was to bring science to community and community to science, we identified a group of researchers who were doing water research. Okay, so that was the first. We found Wessal and her team first.
Okay.
And then we explained to them what Bucketloads of Health was hoping to do in terms of public engagement in research and science, health-related research and science. And she said that she would love to do it, that she'd never done a public engagement activity before, and she was extremely enthusiastic about it. And she put us in touch with Yondela, who was the one who talked about the slimy, stinking, horrible black water. And he had worked with Wessal as a co-researcher on some of her research in Enkanini. And so Wessal introduced us to Yondela, and we met him at the university and explained that we were wanting to do this project, and we asked him to identify people that would be interested. We said we didn't just want to have people whose houses were connected to the water tanks. It would be good to have some perspectives of those people, but just to open it up to people that he felt would be interested and available, and who had either had previous experience of being a co-researcher, being a research participant, or no experience of research at all. So that was what we said to Yondela, please can you go and find people for us? He found people for us that came into the project. So we had a mixture of males and females of different ages, some of whom had access to that rainwater, clean rainwater, some of who didn't, and some of who had been involved in research before, and some of whom had really no idea about research at all. So it was quite a mixture. And then with Delft, as I said, we've been working in Delft for 8 years, and we have grown a very extensive network in the Delft community. And we spoke to a woman who we'd been working with on a community safety project, and again asked her to mobilise for this project. And it was a very different situation in Delft because the research wasn't being done in Delft. And so we said, look, we need 15 people from 5. We tried to open it up across different areas of Delft so that we get, it's not just all from Roosendaal or all from N2 Gateway. We'd like to work with men and women. We'd like to work with older and younger people. We'd like to, if possible, we'd like to work with both Xhosa and Afrikaans, because Delft is a very mixed community. And that's what we said to Farida, and she went off and she found people that said that they were. And I mean, availability for 5 days is a big thing. These creative workshop processes are very intensive and they're long, back-to-back 5 days. That's a practical kind of way of bringing people in. Are they actually available? And then beyond that as well. So, does that answer your question?
Yeah,